Hello, everyone. My name is Wayne Charles II, and I am a proud member and past president of the Rotary Club of Harlem. I'm also lucky to be the assistant governor for Rotary District 7230. And lastly, I am a representative for Rotary International at the United Nations in New York. And today I'm very happy and very proud to introduce to you Ms. Lorraine Shamalla-Hannah of UNICEF. Ms. Lorraine is also the Communication for Development Specialist for polio. So Lorraine, thank you so much for joining me today.
Thank you, Wayne. Can you hear me clearly?
I can hear you loud and clear, and I'm happy that we are able to be in front of each other today. And thank you for taking your time out to speak with us about the continued partnership between Rotary International and UNICEF.
Yes. Thank you, Wayne. First of all, I'd like to take this opportunity to thank you for having me be part of the World Polio Day program. And on behalf of UNICEF, I would also like to thank the Rotary and District 7230 for this opportunity and all the support that you give us for polio eradication.
Thank you. Thank you. Thank you so much. Let's just get right into it. For our virtual audience, they can see it's pretty clear, pretty evident that I'm currently based in New York City. And right now you are based in Kenya, which happens to be in Africa. So I wanted to know if you can share with everyone the great news that just came out of Africa in reference to polio.
Sure. So in August of this year, the World Health Organization certified Nigeria to be polio-free. And that means that in the African region, we currently do not have the wild polio virus. Now, this is incredible. Of course, it's quite an achievement for the African region. But at the same time, with that said, we also have to be very careful because we still have two countries that are endemic. This is Afghanistan and Pakistan. And as you can see, with what's just happened with COVID-19, we just need to make sure that we eradicate completely instead of making other countries more vulnerable and having the spread continue. Over to you, Wayne.
Thank you. Thank you for that. And we'll just have a few questions for you that I would love for you to help us answer, and once again for the virtual audience watching. Lorraine, can you tell us about UNICEF's role in the Global Polio Eradication Initiative? What has Rotary and UNICEF's partnership looked like over the past 30 plus years?
Sure. So first of all, just to remind everybody that the whole polio eradication initiative was spearheaded by the Rotary itself, and this was in 1988. And when they did this, we came together in partnership with UNICEF, with the World Health Organization, with the Centers for Disease Control, and the Rotary was there. And more in recent years, the Bill and Melinda Gates Foundation, and now Gavi, which is the Global Vaccine Alliance. And all these different agencies have very specific roles of things that they do for the eradication initiative. And for UNICEF, there are two main things that we focus on. One of them is vaccine procurement. So that's looking at supplies and logistics, all the way from manufacturing to make sure that they get down to the children so that they can be vaccinated and to make sure that they stay safe. And the second part of it is looking at the increase in uptake of vaccine. This is building trust within the communities, raising awareness amongst parents, doing advocacy work, social mobilization and empowerment. And that's the part that falls under communication for development. What I do, I'm one of the team members who works on that. And so those are the two things we focus on.
Thank you. Thank you. Thank you so much for that. Now, with it being so close, as we say, this close to eradicating polio worldwide, can you elaborate on why counting down to zero is so important?
Well, first of all, I mean, we've come so far, as you say, this close. And so we need to continue this fight. I mean, we need to finish this completely. As I mentioned earlier, we just have two countries that are still wild polio endemic, and that's Pakistan and Afghanistan. With that said, we all know that 2020 has been certainly one of the most extreme, challenging year with COVID-19. and polio campaigns were actually put on hold. We had to pause them because we had to give support globally, just as other agencies and programs were for this pandemic. I bring this up because one of the reasons we also put this on pause is because if you look at the polio campaign, you will see that one of the ways that we vaccinate children is we go door to door. And by doing this, we need to make sure that we still follow our duty of care and do no harm during a pandemic. So we want to make sure that our health workers are first of all protected, and secondly, that they're not doing any more harm. The polio campaigns are starting to resume. They are starting to pick up again. And the polio program is one that is used to working in complex situations. And we will adjust, and we should continue to finish our work.
Thank you for that as well. Can you also just elaborate? A lot of people are aware of the polio efforts, but they're not too versed about the plus in Polio Plus. So can you elaborate on that and perhaps assist us in knowing how that's helping with the COVID-19 pandemic as well?
Sure. So just to elaborate on the Polio Plus program, it's when we actually give more support than just polio vaccinations. And, you know, if you look at the polio program, we have one of the largest, if not the largest, health network in the world. Okay, we have thousands of social mobilizers. It's a huge investment that we have put towards the eradication of polio with the support of partners, especially with the Rotary support. So we play a very critical role in COVID-19 response. Remember, these are teams of people that can shift relatively very quickly. They're used to working in outbreak response. They've given support in Ebola. They've given support in measles and cholera response. And so we can use them on the ground to be our eyes and ears. They do a lot of surveillance. They can do tracking of work that's going on. The social mobilization teams have been used to educate communities. Remember, these social mobilization teams also come from the communities. So when you're dealing with something such as a pandemic with COVID that has all the rumors and misinformation, they actually give support because they're trusted within the communities. This has been something where the polio program has really been able to support COVID-19 response. With that said, I want to just give you an example of a couple of places where we've been doing this work. In Afghanistan, in the southeastern part of the country, we currently have about 3,500 social mobilizers that have been going around using health promotion messages, hygiene messages, and handing out soap. And in Nigeria and Pakistan, they've been doing a lot of community awareness. I also think it's important, it's been very helpful for me because one of the things that I do for my work with polio eradication is to focus on capacity development. And by putting everything on pause for the campaigns, it gave me the opportunity to give the agency support to develop training plans, which will be very useful when we go back into our campaigns, because the campaigns will never be the same as they used to be with all the social distancing and things people don't really think about, like when we have interpersonal communication and you send someone door to door, think about this trust issue, and all of a sudden someone's showing up at your house with a mask, and what communities think about that and what it portrays. So how do you keep, as I said, UNICEF works on the uptake of vaccines up and the trust within the communities when we have had to go through something like COVID-19?
Well, thank you for that. And you know, of course, the challenges are immense, but I know that we'll be able to overcome them. So thanks for sharing that. Another question that I have for you, Lorraine, what gives you hope in your continued work, and what should Rotarians be hopeful about in the push for global eradication?
Well, I have hope. I mean, we have to have hope. I'm a health officer. I also come from a programmatic country that has had its share of outbreaks. And so I have hope when I see all the work that we do. I also have hope when we see the frontline workers and the commitment they have to their work. You know, people who go out and work under very harsh conditions. It's very hot, you know, in areas that have very low security or places that are inaccessible. We have to have hope. And for Rotarians too, we have to have hope because we've invested in this huge network to eradicate polio, and we are nearly there. But I also think it's important for Rotarians when we just see that when we invested in these networks, how it was so beneficial for COVID response also. These are things that give us hope. I want to give you an example of when I talk about these social mobilizers who work under rough conditions and the kind of work that they have to do. I mean, last year I was in the Philippines. We went to give response for an outbreak, and I was conducting a training in the southeast, southwest. And the training was being conducted in this area where there's a group of people called the Bajau who live over there. These are people who have a very closed community. They're quite elusive. It's very hard for even the government to be able to penetrate into their communities and to gain entree. So when you have an outbreak in a community such as this, you rely very much on your social mobilizers because they can get into the communities, they can gain entree, they can get people to vaccinate. And think about it, because this was a country that had also gone through Denvaxia when there was a mishap with the vaccine for dengue in 2017 and 2018. There was a lot of loss in trust with the government. And when you have social mobilizers who can actually penetrate into the communities, this gives us hope that we will be able to eradicate.
Well,
Over to you.
Thank you. We definitely have to remain hopeful, as I think we all do. And I just want to say thank you so much. You made it through that lightning round of questioning, and you were very informative. And I appreciate you once again taking the time out as we celebrate World Polio Day, and our District 7230, amongst all the Rotarians worldwide, will be participating in various festivities. So Lorraine, I just thank you again for your time. And I want you to continue to stay safe. And we really, really enjoy hearing from you and your impact worldwide in reference to ending polio now. We're this close once again. And in closing, I just have to once again thank some of the individuals behind the scenes that helped coordinate today's discussion, starting with the team from UNICEF USA, Megan, Tala, and Michael, to Rose Cardarelli, which is a Rotary representative to the United Nations with UNICEF, and to my Rotary District 7230 family, starting with our district governor, Mary Shackleton, our public image team and head, Nadine, and lastly, Jason Gonzalez, colleague of mine, Rotary extraordinaire. They all were behind the scenes to allow this to occur. And once again, Lorraine, thank you so much for taking your time out, and enjoy the rest of your day and the rest of your week.
Sure, Wayne. And I too would like to thank Rotarians for their support for this eradication initiative and for all the support that we've been doing this for the last 30 years together in partnership, and also for you for giving me the opportunity to speak to you. Thank you.
Thank you. And I'm going to ask you one last thing before we close. If you could just put your fingers up and with me and say, we're this close.
Yes, we are this close.
We're this close. Yes. And between Rotary and UNICEF, we want to end polio now. Thank you, everyone.